See you again. How you doing, my friend? Well.
All right, and we are good. All right, so we're back. This particular session, as I said right before the break, Holly is going to moderate a discussion, panel discussion. I don't think there's any presentations for this group. It's on Delta 8 and Delta 10, which is very timely compared to what happened last night or yesterday. So we will turn it over to Holly. All yours, ma'am.
Thank you, Gene. Okay, so as we all start to gather back in here and start the discussion, I'm going to first introduce the panel and tell you kind of why I put this group together for you. I fielded a lot of questions as the director of cannabis and a lot of questions about how to start a business and the rules, the regs, the permits, everything. So today we're really lucky to have some very forward-thinking people in the crowd and here on the panel with us. So Laura Fuentes is a pharmacist. Laura is the co-founder of Green Roads. Who's heard of Green Roads? So she is a compounding pharmacist, started that company with someone else, still is there as their chief science officer, and when it comes to knowledge about a cannabis product and your body, been there, done that, she knows it, and she's started a company. So a wealth of information like we talked about earlier. Sir, here's somebody you should come and meet and connect with. So then sitting to her left is Cole Diamond. He is the co-founder of Seed and Bean and a white label or a brand name, I just drew a blank, natural name. Pure Native. My dog loves those treats, by the way. I was telling him last night, he limps over to where they are and then looks up at them. And then when I give them to him, he just runs away. So he has learned how to beg me for those treats. But he is a happier, better dog when he takes those treats. And he is 85 pounds and a giant schnauzer. So if you haven't been online to see Seed and Bean, I would highly recommend you do it. One of the reasons I wanted Cole on this panel, if you didn't hear him yesterday, was he has really navigated through some very complex permitting issues with the state and various state agencies to bring this cafe to life in Fort Myers and now spread it around and possibly, we hope, franchise it. So, and then launch a line himself. Dr. Matthew Curran, if you don't know Dr. Curran, you better get to know him because he actually manages about 80% of the program for the state of Florida and FDACS. Once hemp leaves the cultivation field, Dr. Curran's division permits it. So he is somebody that you would want to know and know about his group. If you have questions, he is the one you should be asking the questions of. So any questions about our panelists or comments? Anything in particular when you saw the headline on this panel that you thought, I want to know this?
CBD did start the health and wellness trend in the hemp space, and then Delta 8 picking up where it picked up. I was a little not interested in it at first, but it's performed well. It's actually doing some therapeutic stuff. So I specifically wanted to see, outside of the recreation and the labeling and that portion of it, the health and wellness behind possibly Delta 8, and if you're seeing some inroads there, because I'd like to invest a future in that product line.
Okay, we will address that. Anybody else? Okay, I'm good with you interjecting, raising your hand at any time and stopping us. I like the panel to be a little more informal. It's for the benefit of you guys. That's why we're here, to help you, help the industry, help move things forward. So first I'm gonna start off with who read the news last night or this morning about the 9th District Court ruling that came out on Delta 8 yesterday? No? Google it. You need to read it. If you have a retail store, if you have a manufacturing plant, if you have any interest or concerns about this area, you should Google and MJ Biz, Marijuana Weekly, Bazinga, everybody's written about it. And basically, Dr. Curran and I may differ a little bit about this. What they said was, under the Farm Bill, it was clear to them that Delta 8 was legal, if you go back and read the Farm Bill. So I do believe that is going to have to force some other states to rethink what they're doing by making it illegal. And basically the ruling, when I read it, what it said to me was, if that needs to be changed, then the Farm Bill needs to be changed, and the federal government needs to go back to work and get that changed if we're going to allow or say that Delta 8 is illegal. So, yes.
Are you also planning this year or considering any type of regulation such that there would be a license required for the entity, the retail store owner, just sort of like the liquor industry? There's a beer and wine license versus a hard liquor and wine license. So I think there's a division. Are you looking at possibly a hemp retail license that includes Delta 8 that would keep the service stations and other people out of that sort of market?
Dr. Curran?
All right, yes, so that would require a statutory change. The way the framework in Florida works now is that if you're in the medical marijuana space, that's regulated under a specific statute under the Florida Department of Health. And excuse me, then anything else that's sold would have to be under the definition of hemp in Section 581.217, which falls under our department, the Department of Agriculture. And so, of course, that's where the 0.3% total Delta 9 comes in. Our rules are also specific that you can't make any health claims for those products. Anything that's a health claim, again, would have to go back over to the medical marijuana program and fall under their regulations. So that's what you were suggesting would require a statutory change to create that framework. So right now, there's nothing that exists other than having a food establishment permit under our division if you're selling anything in the hemp space for human consumption, which includes ingestion and inhalation.
Does that answer your question?
It does. It sounds like there won't be any regulation or bar set to enter the market and become a retailer. You just need the $650 hemp retail license.
That $650 is for for processing or retailing or wholesaling those products intended for human consumption. Now, if you're getting into the grow side, which is the gentleman sitting right to your left there, his area, but yes, that $650 would put you under our regulations in the Division of Food Safety for the sale of it for human consumption.
So let's address your question you had about wellness with Delta 8. Laura, would you be willing to? And I want to point out that Laura's group and Cole's group didn't jump into the Delta 8 craze right away. They have very methodically watched this, done some due diligence. So I would listen to what they have to say.
Thank you. So I am a pharmacist. I've been a pharmacist for 25 plus years now. And I have to say that I have a friend that still owns a retail pharmacy, and they are part of a big group chat on Facebook. And I asked him, I guess early last year, are you seeing any movement with Delta 8? Any questions in the pharmacy? What's going on out there with the Delta 8 in the pharmacies? And he put the question out there, and patients were coming in and they were asking for Delta 8. Patients are afraid. They don't want to go to medical dispensaries. They don't want to go to marijuana clinics. They don't want to ask their doctors. They're afraid. It's still a giant stigma for a lot of patients. So a lot of pharmacies, little small mom and pop pharmacies, are recommending Delta 8, and when they come in with opioid prescriptions saying, hey, listen, you know, you had a minor issue, don't jump into these opioids. Why don't you try some CBD and Delta 8 products first before you get on the bandwagon of opioids and go down the wrong path? And it was amazing. He has like 50,000 pharmacists that are a part of this group chat, and 90% of them said that they have had the questions, and over 5 to 10% said they carry it and recommend it, and they were all starting to do that. Now, this is going back to the beginning of the year. Now, recently I asked him again, and 75% of the pharmacists are recommending and pushing,
Wow.
for a try. Try the CBD, try the Delta-8 first before you go down that rabbit hole. So definitely, it's a great product, it works, but it needs to be regulated just like anything else.
Cole, do you
So-
want?
Yeah, so good morning, everybody. Let's do it again. Good morning, everybody. Yeah, there we go. My name is Cole Peacock, and I'm glad to be with y'all today. On the Delta-8 thing, to Holly's point, we just started carrying it last week. And the reason for that is because we wanted to make sure that we were following everything to the line of the order. We have, to Holly's point, jumped through so many hoops to get to where we are today because we have such a unique product line and niche in the marketplace with the Cannabis Cafe. We had, kind of echoing what you said here, we had a ton of patients that had gone to their doctors and or to their pharmacist that they said, go to Seed and Bean and get your Delta-8. Go over here. They may not have been selling it, but they were pushing it. We held off because, there's court rulings that just came out yesterday. There's all kinds of do's and don'ts, and we've been working with Dr. Curran and the department for a year or so. Y'all been dealing with Delta-8? And we did not want to be somewhere in that gray area. We didn't want to be seen as one of these companies that's just selling it and doesn't have the proper licenses, because there's a ton of those. But it's something that really has come into the marketplace in a strong force. And what I have noticed from our everyday customers is they're comfortable using CBD, and the next step is Delta-8. There is a definite line where people are comfortable with a medical marijuana card and going through that process and really kind of getting into that side of the cannabis section, or staying where they really are comfortable with the CBD wellness component and for specific uses, whether it's anxiety or what have you. But Delta-8 is here. It's going to be here. I agree there needs to be some regulation around it. And one of the things we did instantly when we started carrying is we've got an info page in our stores right at our counter that says, here's what Delta-8 is, here's what Delta-9 is, here's what marijuana is, here's what hemp is. And it is almost like bullet points that have come from either information from FDACS or other spots, because people just don't know. I mean, the biggest challenge, I said this yesterday, is educating them and making sure that their wellness path is something that they're comfortable with and you can help them with moving down there. Education. I mean, that's the...
You don't have a category that says devil's weed?
No, we don't. Who knows what's next, though? We don't now, though.
Well, but also to add to what Holly was saying about the Ninth Circuit Court's ruling, right now it's illegal in 30 states.
Yeah.
I mean, it is illegal everywhere. So I don't see that ruling is going to change that anytime soon.
I have a question on the compound itself. I'm not a scientist, but its origin is from CBD isolate, because the native Delta-8 in the plant isn't enough to extract. You can't natively extract Delta-8 from the raw plant to have enough to produce the product, right? So it's made from the CBD isolate. Has anyone been doing any chemical studies on, since it started from that molecule, does it produce similar effects in the Delta-8 state? Because I've, almost to your point, with my patients, CBD cracked the nut for them, and then if there's a severe pain, hip replacement, or severe anxiety, I'm comfortable now suggesting Delta-8 for that, and the feedback has been great. So is anybody collecting any data around or studying from the CBD molecule to the Delta-8? Is there a symbiosis there or something? Or?
Well, I think before the hemp bill passed in 2018, there was no research in the United States on any CBD products. It was illegal to do research. Nobody would touch it. And even still today, it's very difficult to get universities and people involved in wanting to have studies on humans with these products. So I haven't really seen any good studies on Delta-8 yet that I would say are quality. But that's all going to have to change. Just like CBD, all the research is really starting to come out. It's really picking up. I mean, you saw the research about the CBDA and CBDG with COVID and all that craziness that went on. But all these things need to be studied. I mean, people, especially in pharmacies, they want a white coat experience. They want to know that there are white coats behind that and tested it and made sure it's a good quality product.
So the challenge on the retail side, and Holly, I'd love to suggest this and put Healthy Hemp Outlet and any other retailer out there that wants to do this. I've got over 300 positive reviews on the website, but I can't post on Facebook or Instagram that this might help you and might help you
right.
get a good night's sleep. So
Right.
in the credit card restrictions and trying to get reapproved, they're now asking you to sanitize your site and remove all that. And as I was starting to do that, I realized that's what was happening. Pretty soon I won't be left with a website. Can we start a group in Florida that anecdotally is collecting this? It's technically trials, but it is anecdotal, but it's got to come from somewhere in between. And I think, Carlos over there in Ybor and just other stores that are reputable that want to go, the whole spectrum on the full plant from health to recreation. Can we start a group to collect data? And I was really surprised that Delta 8 didn't flood the store with kids. I've had nothing but adults in a positive experience, and I like the word adult choice in that because, like yesterday, I think a lot of us went and bought liquor and had a good evening, and that was your adult choice.
So I'm going to ask Dr. Curran to speak just a minute about some of the topics that you brought up. And also, there is a group, and I can connect you with them, that has formed around the Delta 8, and I'm glad to put you in touch with them.
Yeah, so what you, just kind of going back, trying to log a couple different points that you had made, going back to your first statement that it was created from CBD. So that touches on one of the second legal aspects. I'm not a lawyer, so I'm not going to make any legal interpretations or anything, but just following those cases going through, one of them was, is it legal or not? And then, of course, we read the articles that came out yesterday, and I'll leave that for the lawyers to interpret. But the second aspect that's been discussed in the legal forums are you have a naturally occurring compound that occurs in trace amounts in plants. They know how to synthesize it. You take it, you heat it in an acidic medium with a catalyst, and then you form Delta 9, Delta 8, because you do two steps in that chemical process. So you have to worry about residual Delta 9, but that's another conversation. But that synthetic pathway, a lot of states, including Florida, prohibit synthetic cannabinoids. It's a criminal violation. So that's one thing to be cautious of as well. So some of the legal aspects are, can you synthesize a naturally occurring compound? It's done all the time in pharmaceuticals and things like that. But in this arena, is that legal or not? And that's I don't know that that's been decided yet. So as far as what you have to be concerned of when you're synthesizing something versus when it occurs naturally, when you get to molecules that are the size of CBD and Delta 8, and they're 20-some carbon size molecules, so they're small in the grand scheme of things, but they're big enough, and molecules are three-dimensional in space. We see them on paper, on screens all the time, and tend to think sometimes they might be flat, two-dimensional, but they're not, they're three-dimensional. So when atoms form together, they can form mirror images, just like your hands. Okay, we've each got a right and a left hand, and they're mirror images, but if you overlay them, they're different, right? So the same thing exists with molecules called stereoisomers. And one of the most notorious examples is thalidomide. And this was a drug used back in the 50s to relieve anxiety in pregnant women. Well, there's a right-handed and a left-handed conformation of that. And I forget which one was the good one, which one was the bad one, but one of them relieved the anxiety. The other one was a teratogen, meaning it would attack a fetus. And so there were a lot of children that were born with deformed extremities, because what would happen is the pharmaceutical company knew the difference and they were separating it, but when it was administered to the female, her body was metabolizing it into the harmful form, and those children were born with deformed extremities. And so that's kind of worst case example, and Laura could probably speak more to that than I can intelligibly on thalidomide, but those are some of the concerns when you get into synthetic organics that you have to be concerned with. And when you look at dietary supplements and things like that, you also have to pay attention, and they do in that arena there, because you're dealing with macromolecules that can have these stereoisomers. Sometimes they're benign and they have no difference. Other times, worst case scenarios, they do.
So if you all wanted to know or I had to relearn organic chemistry. Dr. Curran spent hours with me reteaching me organic chemistry to learn this. Yes.
Good morning. Wyman Dickey with Americana Labs. We're running into an issue of getting more questions about Delta 8 products underreporting the actual Delta 9 THC levels in those products, to the point of having Department of Transportation reach out to us because they've had truck drivers who are taking Delta 8 products and failing drug tests because of the levels in that. We have our methods. We can kind of address and identify it. We have the sensitivity needed, but I know as questions come into us, and there's a lot of dialogue online about not all labs being able to do that. And that's a concern certainly for the industry and products being out there. Any thoughts?
Dr. Curran?
Yeah, sure. So you identify a very real issue. And so when you go back to the synthetic route for making Delta 8, you start with CBD, acid, heat, catalyst, and what you do is two steps. You close the bottom of that ring, and then you move that double bond. And moving that double bond from the 9 position to the 8 position to 100% completion is extremely difficult. So what you typically have left is residual Delta 9. And then, so not only that, if you can't separate it out when you're distilling your product, you're going to carry that Delta 9 with the product. And if you have a high concentration Delta 8 product, we've seen those 10, 12% Delta 9s. And then even when they're diluting it down to 8, 10% Delta 8, you can still trip that 0.3 limit. So you're right, a laboratory has to be able to test for that. Now, some of these tests that were derived, I don't know too much about them, but my question for those is, are they just looking at, rudimentary tests looking at THC, where you're going to have all of your isomers, or, are they looking at Delta 9 only and picking up that Delta 9 from, that's residual from the Delta 8? But
Right.
Those are more clinical tests versus, running LC or GC tests.
And let's keep in mind, in the state of Florida, to be allowed, you still have to pass the total THC test and have a COA proving that. If Dr. Curran's team goes out and pulls a product and tests it, and let's say it's a Delta 8 and it blows past the total THC test, they do stop sell the product.
So to that point, earlier, yesterday, I talked about how we triple test everything, and then every product we bring in, we test again. We have had products that have come in and been hot. And if we wouldn't have run those tests, we would have put our customers in harm's way for a drug test or whatever else. So you really got to be careful where you're buying your product from, who's manufacturing, what labs they're using. But to Holly and Dr. Curran's points, we've done everything we could do to make sure we fall within the guidelines set by the state and the Farm Bill. And it's a challenge. You've got to be willing to spend the money up front to do it, and you got to make sure you got the right products, and you got to pay for the testing. And it's not cheap, but the repercussions are being either shut down or having a license pulled or having a bad reputation in the industry.
And DOT, if they're failing tests there, that's just presence of, it's not level of.
Right.
So that's a problem. And they don't understand that a full spectrum product can cause a problem for them. Education, education, education. Who had the next question? Yes.
Greetings. My name is Javon Bell. I attend Florida A&M University. I'm a sophomore, and I'm currently studying agribusiness. And the question I want to ask you guys, do you guys think that this Delta 8, can help create a gateway in the future for stronger or different strains of marijuana?
I think on any of these products, when you take it for long periods of time, you develop tolerance. So people want more and more because a lot of these people are taking these products to get high, and they want that high feeling. So they just have to keep taking more and more. It's kind of the same thing with the opioids. You get a tolerance, you have to keep taking more and more and more. It's the same kind of reaction in your body.
So do you think it'll create a gateway to help make it legal in the future? Since we're moving, because it's a slow process.
So that's the question. Yeah, I don't believe, as a regulator, I don't see that as a correlation.
Right.
I see it as, I'm going to take a deep breath and tell you something I learned in this legislative process. As a regulator and a state employee, there were only certain things I could control. I had elected officials who passed bills. They gave us the bills, and they became, the governor either signed them or didn't, and they became statute. Then a certain department is tasked with implementing that statute. And you have to create rules on how you're going to implement that statute and regulate it. Only thing that I could change or affect change on as a state employee were the rules. Statute has to be changed by our elected officials. So that is a process where you need to get involved and reach out to your elected officials. They all welcome your input. And So I don't see Delta 8 as a gateway to legalization. I do see it as perhaps getting the elected officials' attention because it's being talked about a lot more. That's what I would say.
Thank you.
Okay, wait a minute. Jason's next.
Jason, Master Industries. My question is, and maybe you've answered this, and I'm sorry coming in late. So with Delta 8, there's, I guess, a debate whether it's synthetic or not. And what I mean is, if it's made in a lab, right, we take CBD, like what you were saying, convert it to Delta 8. In my opinion, that would be a synthetic. My question is, what is your opinion on the difference of something that's grown naturally or versus converted in a lab? Is one synthetic versus the other? And again, I don't know. That's why I'm asking the question.
Yeah, so as a chemist, Delta 8 is Delta 8 is Delta 8. A molecule, if you have just that, if you could theoretically have just hold a molecule in your hand, one single molecule, there's no way to tell where that came from. Because if there are any differences to it, it wouldn't be the same molecule, okay? But the issues that surround synthetics versus naturally occurring, and not all naturally occurring compounds are healthy either. You know, there's lots of things out there that are poisonous to us and to animals and things like that. So are the residuals that go along with it. Do you have a different ratio of stereoisomer formation when you synthesize it versus what nature does? Are there impurities that are carried along with it that you get in the synthetic route that you don't see naturally? So those are a lot of the harmful things that you have to be careful of. When we run some of these samples through liquid chromatography, we see some peaks that we don't know what they are. Are they benign peaks? Are they harmful? We just don't know. So, and we don't know if, kind of how they came there, whether this was synthesized or what have you. So those are all the things that are unknown that have to be studied before a pharmaceutical, drug can be given FDA approval to be administered to people.
Understood. I just know like THC, right? So that is quote unquote synthetic. It doesn't happen naturally.
Right.
It still converts, and I guess it was some other drug in 1954.
Yeah, there's a lot of old chemistry out there in the THC world that is being revived. THCO, I've never seen any credible reports that it has ever been found in nature, and it's, acetylating Delta 8 basically.
Charles?
Yeah, it's Charles Felix with Cannabis News Florida and South Florida Hospital News. But I've been to a lot of different shows, and a lot of the CBD shows, Delta 8. In fact, I had one room of totally Delta 8 products, which was a little scary to begin with. But now that the Ninth Circuit has said it's legal to be able to, or not illegal per se, what about the packaging? What about who it's selling to? How do you control how it's being out there? I mean, if a pharmacist decides to recommend it to a patient, or a doctor recommends it to a patient, that's one side of it. But when it's put out like candies and Skittles and that type of stuff, and you have that and the regulations, does the Ninth Circuit also, what they're saying that's okay to do, that I can put a bowl of Skittles out there with Delta 8 in it? It's a little scary out there that somebody says it's okay, and then all of a sudden the market becomes flooded with products that look like crap, to be honest with you.
Yeah, so there's a lot to unpack on the regulatory side there. Our rules were set up to apply to all cannabinoids that were permissible for sale. And again, on the hemp side of things, it can't be a prescription or anything like that. If it's medical, it gets set off in a different category. FDA does take action, as we've all seen in the news, against those making medical claims. Again, in Florida, we have our medical marijuana program, which is totally different in that. So whatever cannabinoids are permissible for sale, they all have to follow the same general requirements in terms of packaging and labeling, cannabinoid content declaration, serving size, so that way we can test those. And we also have limits on contaminants, pesticides, heavy metals, residual solvents that are commonly found in these materials. And so whatever cannabinoids are deemed legal by the courts and then now can be sold on the market, the same general requirements would apply to those. Now, there's a lot of products out there. Getting into those candy names and so forth, you getting into copyright infringements, in which case that was more into that civil realm from the owner of that brand name taking action in a court against somebody using their name without a proper license.
I agree. The question to further it is, when you have products that are out there that are, I guess, seemingly okay, because now you're going to say, well, Delta 8 is good and I can sell it anywhere. When you go to shows, and it's not necessarily in the state of Florida, but there's products coming in from all over the country into the state and being sold at 7-Elevens and that type of stuff, that policing is almost impossible to be able to do, but really detrimental to the people taking it that don't know what to expect out of it.
Yeah, so we dealt with that issue, and you're right, it's very difficult to deal with because of the sheer number of products that are out there, but we have what's called an approved source requirement in our rules. And we modeled this after our food regulations. And so on the food side of things, if you find products at your local grocer that were packaged or they're manufactured in any of the other 50 states outside of Florida, they all have to meet the same sanitation requirements. And so it's somewhat of a reciprocating sanitation level. Okay, so you don't have to worry that they were manufactured in some different environment. So that works quite well, that reciprocity does. Now, we modeled the hemp requirements after that because all 50 states don't have the same regulations when it comes to the sector. So you have some states that don't have any regulations at all. And so our approved source requirements require that it must be manufactured in a facility that's permitted by either the health or ag department, and inspected for sanitation and meets their requirements. If we do background work and we find that product was manufactured in a state that doesn't have those requirements, we stop sale it and it can't be sold.
So I am going to speak up here and then ask Cole and Laura to comment on this. So we saw this, by the way, Dr. Curran predicts a lot of this before it ever happens in the team. We saw this coming and tried to get ahead of it. We put forth a proposed bill that actually asked the legislatures to let us set up a registry and with Dr. Curran, so that if you want to sell your product in Florida, you got to register it with food safety and get a stamp of approval before you're allowed to put it out on a shelf. We have limited tax dollars that we can spend for inspectors and vehicles and gas. So we were trying to come up with a proactive approach that was very mindful use of our budget that we were given. Like in a lot of elected officials, it takes a couple sessions to get things passed. So we're going to hope that something like that works next time. And I think it would address some of the issues in consumer protection that we have concern about products. So because you can't be, it's like the police force, you can't be everywhere at once. So that was what we saw as a more proactive, responsible use of dollars. So as a manufacturer and as a retailer, would something like that be helpful?
A lot of states are already doing that. They have registries, and you can go on their website and see what products you're allowed to sell in the state. A lot of states, you have to submit your labeling. They have to approve your labeling. They have to approve everything. So every state is different, and it's very difficult to try to keep up with that. But I don't know that it really curtails bad behavior. Bad behavior is going to happen anyway.
So the best thing that anyone in this room can do is work with FIHCE. We get products sent to us on a daily basis from every city and every state and everyone who thinks they have the best product anywhere you can dream of, whether it's Vermont, California, Kentucky, Tennessee, it doesn't matter. The bulk of those products would not pass Florida's requirements. But if you take them because it's got a shiny package and you think you're going to get sales on them, that's on you.
Right.
What I would suggest that every one of you do is police this industry and work with FIHCE. There have been multiple times where we have called the department and said, hey, by the way, you may have a bad character over here. They will find an inspector to go down there, but if they don't know, they don't know. And the only way for us to be successful as an industry and have the reputation of being fair and honest players is for everyone to act that way. The minute you kind of go on a second path and just take a product because the price points are right and you may get your return that you're looking for, I'm going to say it again, that's on you. There are a ton of great companies out there that follow, they're registered, they even go and work with FDOCs from out of state. Use those companies. Don't use these fly by the night, hey, I'm going to make a quick dollar over here, and there's no testing with the product. The label looks like they printed it in their home computer. I mean, just pay attention to what's in front of you. Yeah, I would tell you, if you get a product you're looking at, and it doesn't have a QR code on it somewhere, do not use that product. That means they're not willing to stand by the testing. Any one of our products, you can take your phone, snap it right there, and see all the test results. If they're not that way, and they're not going to work through the regulatory issues to do it, I would almost be willing to bet that they're not good. They're not good players in the industry.
But just to take it a step further, don't just look to see if there's a QR code. See what the QR code says.
That's right.
Because a lot of people have QR codes, and it's a lab from 2018. It's a lab for their raw material. It's not the finished product. It's not the current batch you have. They only have one batch listed yet. They have 10 different batches on the shelf. So don't just look at the QR code. The QR code doesn't mean anything unless it takes you somewhere and you can actually match up the product you have with the product on the QR code where the lab is. QR codes don't mean anything unless you follow through that last step. Check it all the way through.
That's a great.
I actually see products that are held in Publix. And you would think Publix is very scrutinized and that they would have only quality products. No, I'm here to tell you they don't.
They don't.
They don't. They absolutely don't. There's a QR code and it leads somewhere, but it's not to that product on the shelf.
That's an excellent point. And again, if you're following what Florida requires, every batch you get needs a new test to it. Mm-hmm. So every time we get a new batch made, we're getting a new test QR code to go on top of it. And if we run through a batch in 5 weeks and we do another one, we're going back to the testing labs, we're going back to the codes. And that's an excellent point, because I've done the same thing at Publix. I'm like, damn, who is this from? Picked it up, not even a Florida-based company, and their QR code was 3 years old. So again, there still needs to be education in this industry.
And I'll add one more point to that if I could, on the QR code. So our program, we do check products that are available out in the market. We have surveillance sampling, we do consumer complaint-based sampling, and we will go out and test products in our labs. And so we have in-house laboratories, we don't contract that out. And what we do is we test the product that the consumer is going to consume, finished product. So sometimes you get a lab report that's upstream, and there's a lot that can happen going downstream. So sometimes our reports are going to be different for that reason or many others from something you'll see on a QR code. So understand where that QR code, where that lab report is. Is it the finished product? Is it the batch of extract? Or is it somewhere in between?
And I will tell you that when I was at FDOCs, I got numerous reports every week from various people in the industry and consumers, and that is where we found a lot of bad actors. So help us help you in the industry by, when you find something that you know is not right, you can reach out to cannabis at fdacs.gov. There's 3 other sites you can report it to. You don't have to leave your name and number, and we'll go investigate it. So, Jody, you had a question?
I did, and it was perfect. So, Jody James with Florida Cannabis Action Network. You might see our exhibit. We have 5,000 postcards that talk about safety first. We're calling it QR code love, because that's exactly what Cannabis Action Network has seen. And of course, we were supporting the bill that would register products. In order to buy windows for my house, they have a Florida product code on it, duh. But I wanted to find out, Dr. Curran, the products that you're testing, is that public record?
Yes.
So an industrious organization that was funded by someone who cared, any of you, could make that information available to consumers.
Yeah, if you reach out to me and you want to know, you have a request for a particular product or what have you, yeah, we're happy to supply that.
I mean, because that is exactly what we're finding in the marketplace. And if anyone would like to take those postcards home, I mentioned the quantity, because if you want to put them on your display or give them to your people, or we want to get them out.
Thank you. I'm going to let him go. Sorry.
So I've been hearing increasing concerns from employers regarding having their drug-free workplace status challenged because of Delta 8 products being found in employees' blood when there's an incident. And so now that it's legal, but yet there's challenges with how it's produced and regulating that, is there somewhere that we could point employers to, here's guidance versus just blanket saying you're not allowed to have Delta 8, period, at all? Here's how you educate yourself to go be safe, and here's what's allowed within our business so that we maintain drug-free workplace.
Okay, so first of all, let's make clear, it's not Delta 8 they're not allowed to have, it's THC in their bloodstream. So that's the problem. And it could be the Delta 9 that's in it that's causing it, and it could be something else. So there's two tests that you can do. There's a test for presence of THC, and then there's a test for the level of THC. And if you ever are testing, you need to make sure you're asking them what they're testing for. And drug workplace tests only test for presence of. So if they have a policy that says we have zero tolerance for THC, that's a corporate policy that they get to make. And they can make that. And that's their choice. So I worked for a bank out of California a few years ago in my last banking project, and they just didn't drug test at all anymore because of the laws and regulations in California. So that, and feel free to speak up, but that's really an employer's choice. And it has nothing to do with the legality or illegality of it. They're just, are they tolerant of having THC?
Right, and remember, when you are an avid THC user, it's a fat-soluble product. It stores in your fat cells, so the more you take and the longer you take it, the longer it takes to get out of your system. So you might have had a great weekend with your friends, and then you come to work Monday or Tuesday and get subjected to a THC test, a drug test. You might test positive. You don't have it in your system now, but it stays in your fat cells, so it's still going to be there, but you're not high today. So that's another issue. It's unlike alcohol and other types of testing that they do.
I sometimes wonder about that testing, and when you think about it, you think these people are so honest and upholding, but if a person failed a drug test and their family and partners are ashamed of them, it's probably likely that they might say, oh, I bought legal Delta 8, and that was it when they were really a Delta 9 consumer. So sometimes I hear that.
That for sure. There's a definitely cross culture there as well. Yeah, it's difficult because it does stay in your system. And, you can't control what your people do on the weekend, I don't think.
I think
just during work hours is what you're concerned about.
I think from a workplace experience, I've had the privilege of working in corporate America and Fortune 500 publicly traded. And when you operate in multiple states, one policy doesn't fit everything. So California's a great example. So there was the move where things were legal in California. We had employees there that you couldn't really tell them what they could or couldn't do when on a regular basis it's legal and do things. So I've seen corporations start to kind of shift what their really drug policy is based on what's happening in the U.S. and states that are going legal and doing certain things. Now, anyone has the ability to say you can or can't do it if you work with them. But to Holly's point, and I even saw it at this corporation I was with, is there was a test that was generalized, then became to a usage amount test. And that really changed the dynamic, and then eventually went away from drug testing as a whole, because it was just almost too challenging to keep up with different state laws and what was going where, and some of the legalities of it. But I think you're seeing that shift in corporate America across the board. Again, I've said it, Holly said it, Dr. Curran said it, Lori said it, it's education. Even with the employee base and with your employers is, hey, here's kind of how things operate. And they still have the right to do it, but more education, because a lot of times they don't understand.
I will say most of the time, companies do pick that, it's because of their insurance.
100%.
You basically get some type of discount if you're a drug-free workplace, and that's where it kind of stems from. So that's where you're starting to see people, I'm going to save 2-3%. it's not worth it, especially now in our
Yeah.
employment environment.
Well, a lot of it is the employer will say that they're a drug-free workplace. They have policies in place.
100%.
Somebody falls off a ladder, they go to the hospital, oh, you tested for this. Well, now the insurance company says, you told us you were drug-free.
Sure.
We're only paying part of this claim. And the employer doesn't, well, it's not technically illegal, but yet the insurance is.
I don't think any of us are going to solve that issue today. I think that really falls in the work, yeah.
Yeah, so that's why I'm just curious, like if there's somewhere that says, hey, employer, here are the things you need to consider and potentially write into your drug-free workplace policy regarding Delta 8 and educating your employees on.
I can tell you from the employee base we have, if the information is not at FDAX, it's I don't know where you're going to find it, because it is a very in-depth site. You can go through. It'll tell you what state requires from a testing component, where you're at. I mean, it's a pretty informative site. And if you didn't find it there, I'm sure Dr. Curran or somebody there, the brilliant legal minds they have there, can lead you in a different direction to find what you're looking for. But kind of, again, education. So the HR department or whoever's looking over those rules, get engaged with the departments that are regulating these things.
And you're a banker, right? Okay, so having been a banker, retired, I actually at one point in my life got exposure to insurance and all that you're talking about. But there is a lack of education on the insurance company's side, and there is a huge initiative going forward to bring them up to speed. And I have seen, and I'm involved with some groups that are doing that. So it just is like I go out and try to educate the banking group here in the state of Florida just to help so that you will support the industry and bank it and understand. And we actually partnered with CFO Patronus's office and the insurance office, so they put out some memos to all of you here in Florida so you would feel more secure with it and talk to their examiners. So it really goes back to that. And if you know of any groups like that, get involved, volunteer, push education forward. Jody's group is a prime example of groups that are doing that. And there was some bills put forward this last session in Florida to protect workers in workplace also.
A question on dosing and tolerances. Did you tell people it's a natural product, so it probably follows the vitamin label, where turn the vitamin label around, you'll see 400% of this, 200% of that. The body has a balance point. It takes what it needs and it excretes the rest because it's natural. I think that's why they had to decriminalize it. With Delta 8, is there a balance point of such that I try to tell people it's almost like having 2 beers and stopping. You're not going to continue on with the effect like a Delta 9 would be like having 2 shots of liquor and then stopping. You don't know what's going to happen next because of that higher sense of it. With Delta 8, is there a milligram max or toxicity, which would be nice to know, but in general, it seems like 20 milligrams for adult consumption is basic and normal, 50 milligrams is recreation. Are you seeing any studies that say something about 100, 200, or?
There aren't any studies at all right now. And I can
None.
tell you, just like with CBD, everybody's different, everybody reacts to it differently, and everybody needs different milligrams to achieve whatever goal they're looking at. There's no one size fits all with this plant in general right now. So no, I don't know of any dosing. And what we always recommend with any of our products is start slow and increase very slowly, because, gummies and things take 2 hours to take effect. So you might take a gummy now and you're like, hey, what's happening? I don't feel anything, and take more, and then you're going to regret it later.
You'll be on the couch figuring out what the hell happens.
Yeah.
Holly,
Eating
regarding
those Doritos.
regarding
eat those
Florida
Doritos.
and any upcoming laws, I've had a
What's that?
regarding Florida and our state line and cannabis and Florida grown and whatnot. Just had this idea. Is there any future that you see as possibly, if you're going to sell it in Florida, it needs to be sourced from Florida, or your first pass should be to buy it from Florida, or any special incentives for that? Because if my processor's out of Colorado, that's, nice. It's a good state to get it from.
Yeah,
but-
support Florida. Find your Florida. There's a gentleman right behind you that grows a great crop, Mr. Glenn Treadwell. He can get you product that you're looking for, at least in Florida. There's a handful of great growers in the state. When we got into the industry, there were none. But the minute that we could partner with families that have been growing in this state for as many generations as some of them have, we switched over to it. And I can tell you that if you watched the presentation yesterday, there's a picture of me standing at Treadwell Farms and how proud we are to be with them. But that pride is across the entire industry. And when you can have the honor of putting a Fresh from Florida seal on your product, you're meeting the requirements that they put in place, and that's predominantly being in everything in Florida, whether it's growing, manufacturing, and we're a Florida-based company. We want to have Florida products in our stores. We want to support our Florida industry. Nothing against any other state, but I can tell you from my standpoint, I think everyone here should kind of pay attention to it, is when you can call your department in your state and have your conversation and align with what they're doing from a regulatory standpoint, and they can tell you, yes, these are good growers, and yes, they've got their license, and yes, they followed protocol, it protects you, your consumers, and everyone around you. I would encourage you mightily to find you a Florida-based grower if that's what you're looking for, because there are some phenomenal growers in the state.
And I'm going to put in a shameful plug here, but we set the program up in Florida, and the elected officials had the foresight and the wisdom to put it up under one agency, so it would be run consistently, and that would help the industry grow, and that has worked. Then in FDACS, we do have the Fresh from Florida program. It's not just for hemp. We do have a patented logo for the hemp Fresh from Florida, but it's for all vegetables. And I don't know if you all are aware in other ag commodities that is nationally recognized.
100%.
When somebody outside the state of Florida sees Fresh from Florida, they will purchase it and buy it. And that is important. So that's why we aligned the hemp program with the same thing, because we wanted it to be the gold standard in the United States. We wanted people to move their business here. We wanted farmers to benefit from a Fresh from Florida program and other people in the supply chain. And so far we had 75 participating in the program when I left, and that continues to grow. So, and I do believe, because I had people call me all the time and say, I'm moving to Florida because of your program. I'm moving my business here. So, yeah, I think it's very important.
Okay, last. There's nothing wrong there. Last question.
Nothing
I promise.
against Colorado.
On the licensing versus policing, it'd be interesting. How many hemp retail licenses are out there, if you happen to know? And with licensing, that's the first part. But on the policing side, I, as a retailer, would like to see some of the convenience stores be somewhat withheld, reprimanded, or policed, because they're, on one revenue side, taking my business, but the areas where the child labeling and the bad things happen is at that level. So licensing versus policing, where are you at with that?
So I can address that outside of the crop side of things. So in my division, I have roughly just north of about 150 inspectors, and we have 50,000 businesses that we regulate. And about 10,000 of those sell hemp extract products. So just doing the quick math, we can't get around as often as we would like to places. And we always want to get around more. So what we do is we use strategic approaches to get around, and one of them is compliance history. How often did we have violations with those consumer complaints? The eyes and ears of the nearly 22 million people in Florida really help us. We get a phone call that says so-and-so's got this going on. We go out there. If it in fact checks out the way it is, that was a huge resource advantage for us, because we went right to the issue. We do issue fines for people that have serious enough problems. In the very least, if you're selling something that doesn't meet our requirements, it can be placed under stop sale until that problem is fixed, if it can be remedied. If it can't be remedied, then it can't be sold. And so, again, the more serious violations do warrant fines. If you're not permitted, we we take you through that permitting process. Ultimately, if you refuse to comply with that, we have to go through a legal process, but we will eventually shut you down. So you can't operate. That does take time. The legal process is not necessarily a quick one, but it's for due process. So yes, we are out there. I think every regulator would say we'd love to have more resources, but we've got quite a few, and so we try to be as efficient as we can with them.
So to piggyback on that, the local inspector in Southwest Florida that comes and visits our shop all the time, I think now he just comes because he loves the atmosphere and has a good meal, but, checks on what we're doing, and we're always honored to do it. He was sitting in the cafe at one point in time, and a sales rep came in from a local brewery pushing Delta 8 seltzers. He looked at the can, there was nothing on there, there's no labeling. He looked, product wasn't registered. Now, I don't know if he got up and followed them away, but I know a few days later, he was sitting at that brewery writing fines and trying to figure things out. So it does happen. And I said it earlier, they can never hire enough inspectors. So if y'all can help, send the help their way, let them know what's going on. They do go out, they do inspect, they do everything they're supposed to do. It's just, it's a big ass state. There's just.
And I will promise you this, because a lot of things have been said to me in 3.5 years, and some of them have really made my eyes come wide open. But any consumer complaint we get or industry complaint, we go in at a neutral point. We know what was reported to us. We would go in and look and inspect for that, but we don't go in assuming you're guilty. So, because we do know that sometimes people report things erroneously. And so we are very, Trevor and Brian and Dr. Curran, they are very neutral when they go in. So even if I'd find something on social media and say, hey, you ought to go check this out, because some people would post some just pretty amazing things on social media. They would say, well, I know that's what they said, but let's just go in and see what's in there. So they're very neutral when they go in. Yes?
Well, I think I can help Dr. Curran a little bit. I'm in the beverage game. We have a pretty large brewery in central Florida, but we've evolved to wine, spirits, and now Delta 8, seltzers in particular. We've come to their department. That's who we comply with, and it's been very good. We do a lot of co-packing, and one thing that we did just voluntarily, because I've been in the alcohol game for a long time, Anheuser-Busch, et cetera. So the first thing we did on labeling, we said, even though it isn't state or federal requirements, we're making you mimic the 21 or older, all those mandates. So pregnancy and no driving, all the things that are on the mandatory. Now, they've been able to have a little bit more creativity because it is a different category. So we've been watching it closely. The other thing, some of the comments about the certification of the actual active ingredient. Outside of Florida, I will tell you, we've had some problems, and we have a lab, and we've had to triple check many times, and sometimes reject it. Some of the Florida suppliers, and that's why we're here, we want to get more aligned with the Florida suppliers. So we see it as a really big opportunity on the beverage side, but we also know compliance, safety, image, all those things are huge pieces of the future, and hopefully we can get there together.
Thank you. What other questions do we have? We're at about 1:15. Yes. Here he comes with the microphone.
Good morning. I bring you greetings from the heights of Seven Hills, Florida Agricultural and Mechanical University. I am Taquasha Freeman, a first-year master's student in supply chain management. My question to you, is it possible to use data analytics to be able to assist you with being able to stop some of the things that are going on with the hemp using Delta 9?
So when we encounter a product that we have to stop sale for any reason, in the food world we talk about trace backs. Where did the product come from? And there are required invoices, bills of sale, and things and records that, if they're available, we go back, they're required to be there, and that we can go back and find out where a retailer bought that product, where that wholesaler may have bought the ingredients that went into that product. And as you can see, it spiders out real quick because it starts at the ingredient level and filters down. Sometimes we get resistance when we try to go backwards like that, so analytics wouldn't help us in that regard. We do have to sometimes get subpoenas and things like that to force those documents, and even sometimes then we end up with a dead-end trail. So usually, and after a while, we kind of get to know a lot of the companies out of state where common things are coming from, even in state as well. So, you know, it's somewhat of a paper trail that we currently use. We're always, you know, looking for ways to improve things with the information that's out there, but it has to be required information in order for it to be a consistent process that we would use.
And that's a great question and point. I'm going to go back to what Laura and Cole said, and that is, I've been out at manufacturing facilities where they've told me they have this traceable system so they can do what Dr. Curran says and protect people like Laura and Cole, and they put the QR code on the little, or their phone on the, show me this great website. Well, come to find out, that's just a page. And so if you're going to be getting into that world and asking those questions, I'd ask to see the whole system and demos and give me a live example of, okay, this product, this batch was bad. How can you trace it back? So that is an excellent point, and that's the next wave that's coming for consumer protection.
Thank you.
Yes, Charles. We'll let you do that.
Thought maybe you had a twin.
Just confuse you as much as I can to keep on moving around.
That's good.
So I keep out of trouble. It's great to be able to go into a store and get this. Can you discuss the problem, or what I perceive as a major problem, of mail order coming into the state of Florida? Because yes, they may not sell it to 7-Eleven, but I've been to shows where they say, well, don't worry about it. You can just use our website and we'll mail it to you. So
that is, you touched on a very discussive topic that we've had, not just in this space, but just in commerce in general. Obviously, with the pandemic, people being at home, e-commerce has really exploded much more rapidly than leading up to the pandemic. It can be very challenging for us to find out who's on the other side of that screen. And we've tried in several instances, sometimes with not much luck, even taking legal routes, sometimes it's hard to get that information. So there are organizations, for example, a National Conference on Weights and Measures that is taking up e-commerce and how to regulate that, just for commodities in general. But it's an issue that has no resolution at this point, and has been very challenging for us as regulators, is to find out who's behind that screen.
Yeah, and let's not forget, that's a lot of where the fentanyl comes from, the mail. You call a company in China and they'll mail you fentanyl. So it's a big problem across the board in a ton of industries, not just ours.
We actually put a little task force together and looked into that and reached out to sister agencies within the state to help us with that. And we did put together a little team that monitors web pages.
There are a number of people that believe if you buy it from Amazon, it's certified. You laugh, but there are people out there that believe that if you buy it off of the Amazon site, that they're backing that product, and it's eye-opening when you tell them they really don't. So.
Yeah. So has this been helpful? Enjoyable? Well, good. Have we all learned something today? I have. Well, good. Any other questions or things you want to? This has been a great conversation, I feel like, and a great use of time to move this industry forward in a positive way.
Holly, can I say something?
Absolutely.
If y'all have not had a chance to meet the FAMU crew over here, it is, I think, fantastic that FAMU sent down, which I believe are probably their leaders in their program, to learn more about it, to educate the university going back. I just want to commend y'all for coming in, especially at a younger age, trying to figure out how to move this industry forward. So if you've not had a chance to talk to them, I talked to them yesterday. They are four great individuals sitting there. Give a chance, listen to what they have to say, have great questions, and they're the future. If we're going to continue to build this program in this industry, we got to start, now and growing and getting, new people coming into it. So I just want to commend y'all for taking the time and coming down and what you're doing.
Thank you. Interns. Best intern I had from FAMU. She helped me with a lot of technology stuff for the hemp program. All those town hall meetings and the lists, you have her to thank for that. So let's just take a minute, and if each of you want to say a few things and wrap up, and then we'll call it a day. Flora, you want to go first?
Sure, I'd like to just thank everybody for being here and being interested in this industry. It is really important that we try to all stick together and try to keep it as a good, healthy, honest industry. We have to police our fellow companies, which is unfortunate. You have to be out there knowing what you're putting on your shelves or what you're attempting to buy. Just pay attention, because remember, there's an end consumer. I've treated children younger than a month old with some products. So I have to be really careful and make sure that our products are safe. So just always keep that in mind. You never know if there's some desperate mom going into a store, grabbing your product, thinking that she's giving it to one of her family members. It needs to be quality. It needs to be what they think they're getting. So just keep that in mind. There's always an end user. It could be your grandmother. It could be someone else's child. Just always keep that in mind. And thanks again.
Cool.
Yeah, thank you all for coming. I've had a great time speaking in both afternoons with you, but I want to do a couple things. One's a shameless plug. We are Pure Native, and one of our brands is in the process of creating Florida's first hemp beer that is grown and brewed in the state of Florida. Again, using some of the Treadwell product back there, and working with Dr. Curran and Holly in the department. From what we understand, it'll be truly the first all Florida hemp beer in the state, and we're close to getting that regulated and passed out. The second is, if y'all don't mind, please give Holly Bell a round of applause. She is no longer with FDOCS, but she's the reason we're sitting here today.
That's nice. Thank you.
Yeah.
Thank you.
I've seen Holly come out of meetings with smiles and black eyes, and starting this industry from where we were. Thank you for everything you've done. And,
You're welcome. It's been fun. Thank you.
And again, thank all of you for participating, trying to educate, and being good players in the industry.
Dr. Curran?
Yes, sir.
I think everybody here knows the importance of getting your seed from a good seed source. And I guess piggybacking to the last question, what kind of issues has Florida had with people selling seed online or seed that's not registered in the state? And how has that been dealt with?
Yeah, that's going to probably be a question better for Dr. Curran or
So-
someone else.
We actually don't have our seed folks here today.
Yeah, we don't have them here. I will tell you that I've spent more time on seed than I ever thought I was going to. That's how I'll answer that. And after numerous very interactive and lively conversations with the executive director of FIHCE, it's been a challenge, and it's been a regulatory challenge. So we feel like we have solutions. I don't know if Brian and Trevor want to add anything, but it's a challenge. It has been a real challenge. You might talk to Brian and Trevor about what they do, because Kelly's in charge of licensing the dealers and kind of policing them and making sure that they've got proper labeling and all of that. But then Brian's team and Trevor's team have to go out and inspect the farms. And we all know that when you get your inspection, one of the things you're supposed to do is have records of what seeds you planted. So that might be a good conversation for you to have with him. But we've spent more time on that than we ever thought we were going to.
So I'll wrap up. Again, thank you all. This has been a great conversation. I've really enjoyed this. Definitely like the dialogue. I want to leave you guys with 2 points. The first one is, y'all are in the business in some fashion or another. So my strong suggestion is to, before you get into the business or before you make any substantial changes, please reach out to us. It's much easier to talk with you beforehand versus after you've made an investment and we tell you you're going to have to reverse that and then go down a different path. That's just extra money that's going to cost you. It's not going to be a pleasant conversation. We can't give you legal advice, but we can explain the regulations to you so you have an understanding before you proceed forward with that investment. Second point I want to make is, if you haven't noticed or haven't said it, I'm a chemist. And in my near 24 years of public service, I have been tethered to laboratories. I grew up in laboratories. That's my background. So I'm in this area. There's nothing that isn't tethered to science in this cannabis space in some way or another. And not everybody is a scientist. And as a laboratory person, I see a lot of things in lab testing and protocols and interpretations and things like that. If you are going to invest in this space, be sure you have a good scientist that has an understanding of laboratories moving forward. It will pay dividends.
And how can they get a hold of food safety?
They can get a hold of us. Our website off the top of my head is food inspection at fdax.gov. My email address is Matthew, M-A-T-T-H-E-W, .Curran, C-U-R-R-A-N, at FDACS, Florida Department of Agriculture and Consumer Services, FDACS.gov. And
I'll
route you to the
email
right
it out
place.
for everybody.
And DPI's email is dpihemp at fdax.gov. And Nicole monitors that as well as Brian, and they are fast to reply. AES, who does the seeds, pesticides, fertilizer, is AES Cares at fdax.gov. And there is a Cannabis at fdax.gov that I did monitor, but somebody is picking that up, and then we'll forward it to the appropriate division after that. And, you know, I guess I didn't tell everybody, I did leave. I took a job with a publicly traded company that's in cannabis, and it is international regulatory work. It's the name of Flora Growth, and it is here in Florida. So I'm very excited to stay in this space. I think that pushing the United States forward is going to be done through an international initiative, because other countries are legalizing it in a uniform fashion, unlike what we've done here. And that is going to put more and more pressure on the United States to get a more unified regulatory structure in place, which will help the industry because it'll give us certainty. Banking, insurance, credit card processing, all of that, and it'll make the industry flourish. So that's what I'm doing, and you all are free to welcome to reach out to me anytime. My email is holly.bell@floragrowth.com, FLORAGROWTH.com.
I'm not giving you my email.
I used to answer 100 a day, so I'm used to it. Anything else? Thank you, Gene, for all you do for the industry. Thank all of you for all you do for this industry, and appreciate you spending an hour and a half with us.
Wonderful. Thank you, panel. Real quickly, lunch is in Ballroom A. So you're going to come out the doors, turn to the right, and walk almost towards the front of the hotel. I've got Dana and Brittany out there. They're going to be taking lunch tickets that are in the back of your name badge.